8. Bleeding and wounds. The typical adult male has approximately 5 to 6 liters of blood. Therefore, loss of blood 1/3 to a half is very significant, as a minimum amount is required to keep the cardiovascular system working efficiently, thus maintaining life. Signs and symptoms. Bleeding can be external or internal. There are 3 blood vessel classifications. 1. Arteries. Loss of blood from an artery, blood spurts with the pulse and is bright red. 2. Veins. Loss of blood from a vein, blood flows steadily and is dark red. 3. Capillary. Loss of blood from a capillary bed, blood flow is slow and not as bright red as an arterial bleed. Signs of infection. Sharp, swelling around injured area. H. Heat. Area feels warm to touch or a fever is present. Ache. Pain at injury site, throbbing possibly, headache or general feeling of discomfort. R. Redness around injury. P. Pus at site of injury. Prevention. Be cautious when working with sharp instruments. Follow safety procedures in the workplace. Take safety precautions when participating in recreational activities, sports, and games. Tetanus shot every 10 years. Management. Direct pressure and rest. Personal protective equipment (PPE) is important when dealing with blood and body fluids. Use protective gloves to prevent further contamination of the injured site and to protect yourself from blood-borne pathogens. 1. Scene survey, primary survey. 3. Get the casualty to rest. 4. Apply direct pressure on the wound with a dressing. If dressing becomes blood-soaked, then put another one on top of it. Do not remove the first dressing at any time. After bandaging, check for signs of circulation at the extremities, skin color, temperature, and/or tingling, numbness. 6. Secondary survey. 7. Ongoing care and treat for shock. Tourniquets. A manufactured tourniquet should be used as first-line therapy for life-threatening extremity bleeding and should be placed as soon as possible after the injury. If a manufactured tourniquet is not immediately available, or if a properly applied manufactured tourniquet fails to stop bleeding, direct manual pressure with the use of a hemostatic dressing, if available, should be used for life-threatening bleeding. Seek additional training if your workplace requires tourniquets. Management. Maneuver the band 5 to 7 centimeters, 2 to 3 inches above the wound. Pull the strap tight. Twist the windlass rod until bleeding stops. Place the windlass rod securely inside the rod locking clip. Cover the rod with a securing strap. Record the time. Do not place on a joint. It is normal for the tourniquet to cause pain. Types of wounds. External. 1. Abrasions. Scrapes and scratches to the outer layer of the skin. Wash under running water and apply sterile dressing. First aiders may apply antibiotic ointment to promote faster healing with less risk of infection. 2. Incisions. Smooth cut made by a sharp object, e.g. knife or razor blade. Minor incisions, lacerations. Wash under running water and apply a sterile dressing. Major incisions, lacerations. 1. Use direct pressure method and rest. 2. Clean away loose debris, dirt from area. 3. Bring edges of wound together, if possible. 4. Apply pressure by using a compressed bandage. 5. Apply additional bandages if blood soaks through. Puncture, embedded wounds. Objects, e.g. animal teeth, nails, knives, pass through the skin. Often no severe external bleeding, but internal bleeding and contamination may be serious. Management. 1. Do not remove the object as it may act as a plug. 2. Cover object gently with sterile gauze. 3. Pack rolled bandages around object to stabilize. 4. Use direct pressure method and rest, if possible. 4. Nosebleeds. Spontaneous, allergies, high blood pressure, dry air. Management. Sit down, lean forward, and pinch nose below bridge for 10 minutes. If bleeding continues after 10 minutes, seek medical attention. Traumatic nosebleeds. Do not apply direct pressure. Absorb blood flash fluid with dressing under nose. Seek medical attention immediately. Do not blow nose for at least 2 hours. Breathe through mouth. 5. Amputations. Full amputation. 1. Scene survey. 2. Get the casualty to rest. Primary survey. 4. Activate EMS. 5. Use direct pressure method and rest. 6. Wrap injured area in a clean, moist dressing. 7. Secondary survey and ask 3H questions. 8. Ongoing care and treat for shock. 9. Put amputated part in a bag, then in another bag with ice water. 10. If no bag, wrap in moist, clean cloth. Label with time and seek medical help. Partially amputated. 1. Try to keep in normal position. 2. Cover with sterile gauze. 3. Bandage to support. 4. Keep dry and cool. Apply cold compress to outside of bandage. Animal bites. 1. Scene survey. Contain animal if possible. 2. Primary survey. 3. Secondary. Ask 3H questions. Clean wound with clean running water. 5. Allow wound to bleed to cleanse. 6. Use direct pressure method and rest if bleeding is severe. 7. Monitor vital signs. 8. Ongoing care and treat for shock. 9. Activate EMS. Jellyfish. Signs and symptoms: itching, burning, severe generalized pain, nausea, vomiting, difficulty breathing, sweating, possible heart failure. Management: 1. Scene survey. 2. Primary survey. 3. Secondary survey. Ask 3H questions. 4. Wash sting with large volume of vinegar or baking soda paste if vinegar unavailable. 5. Use hot water immersion 20-30 mins to reduce pain. 6. Monitor vital signs. 7. Ongoing care and treat for shock. 8. Activate EMS. Ticks found in dense woods may carry Lyme disease. Management: 1. Scene survey. 2. Primary survey. 3. Secondary survey. Ask 3H questions. 4. Use tweezers to remove tick close to skin. 5. If no tweezers, use fingers with gloves or cloth. 6. Wash area and hands. 7. Ongoing care and treat for shock. Leeches found in swamps, ponds, lakes, feed on warm blood and are hard to detach. Manage: 1. Scene survey. 2. Primary survey. 3. Secondary survey. Ask 3H questions. 4. Use flat object, e.g. giant credit card, to detach leech from head first. 5. Repeat from other side to break suction. Flick leech away. 6. Clean area with clean running water. 7. Apply paste of baking soda and water for irritation. 8. Monitor for infection. 9. Ongoing care and treat for shock. Abdominal injuries. Causes: knives, broken glass, car accidents, bullets. Management: 1. Scene survey. 2. Primary survey. 3. Secondary survey. Ask 3H questions. 4. Activate EMS. 5. Control external bleeding and dress all wounds. 6. Lay casualty on back with knees flexed. Do not touch or replace exposed organs. Cover with occlusive dressing and bandage. Moistened, sterile dressing if allowed. Stabilize any impaled object. Do not remove. Do not give anything by mouth. 7. Ongoing care and treat for shock. Types of wounds: internal. 1. Contusion, bruise, minor, caused by fall or blow. Apply cold compress, 10 min on off. Do not apply ice directly. Major, large bruises, more blood loss. Deformity may signal organ damage. Signs and symptoms: pale, cold, sweaty skin, dizziness, nausea, thirst, blood in urine, fluids from ears, nose, mouth, difficulty breathing. Management: 1. Scene survey. 2. Identify yourself, get consent. 3. Primary survey. 4. Position casualty to rest bruised area. 5. Activate EMS. 6. Secondary survey. Ask 3H questions. 7. Ongoing care and treat for shock. 2. Crush injuries. Lead to swelling and kidney failure. Management: 1. Scene survey. 2. Primary survey. 3. Activate EMS. 4. Move casualty as little as possible. 5. Treat wounds and apply ice. 6. Secondary survey. Ask 3H questions. 7. Ongoing care and treat for shock. If